Okay, so can you please share all the pics again on the group? If we just joined the group, please, please. Okay. Okay, so someone is asking, please share the question picture also in the group. So, okay, please don't worry, I will write in group separately.
Recording in progress.
Okay, guys. Okay, so can everyone see the prescription page? Okay. So I'm sharing the prescription in group. Okay. So patient is allergic to penicillin. Write down the penicillin allergic here. Name of patient, signature will be there. Date of your exam day, and the patient having any reaction over here. Okay, so your task say write down the vancomycin and write down the mupirocin. So vancomycin, you have to write down the vancomycin here in the capital letter. The dose will be 1 gram. You have to look at the BNF as well. The dose is 1 gram, the route is IV, the start date will be your exam date or according to your task. Count down the next 10 days and put over the stop date here, right? And write down the all dates in this section. For example, your exam date is on 7th May, 7th May, 8th May, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, right? So 7th and 16th, stop date here. Vancomycin capital, 1 gram dose, route will be IV. Indication will be patients is allergic. Indication is MRSA wound infection, right? Your name, your signature, additional information if you want to write anything according to your task. So you have to repeat once again. Vancomycin, 1 gram dose, IV route, start date and stop date will be same. Your name and signature and indication RMSA wound infection, right? So additional information you can write over here. So other medication is mupirocin. So mupirocin we give 2% ointment as a topical. So you have to write down the mupirocin over here. When you open the BNF, you will see the mupirocin can be given for the 4 days. So there will be dose as well. As you know, we usually don't write the creams dose, ointment dose, right? You can write here apply to each nostril in the dose side. You can write apply to each nostril. Road will be topical. There will be start date and stop date as well, right? Okay. So once again, your name and uh, your signature. So stop date will be from 7th May, 7th, 8th, 9th, and 10th for 4 days. The last section, 11th, you can make a cross. Put just big line over here, right? So from 7th to 10th, your name and indication is MRSA eradications, MRSA eradication, and additional information you can write over here. This is whole about third scenario, MRSA wound infection. Yes. So your task there, write down the vancomycin in both section because it's for the 10 days. Write down here as well. Dose will be 1 gram, route will be IV, start date and stop date will be same. Start date is from 7th May, for example, and stop date will be 16th May. So fill those columns, right, from 7 to 16 here and write down your name and signature and write down the indication as well. Other medication we have to write down mupirocin. So when you open the BNF, mupirocin usually being given through the uh, is a ointment, 2% ointment, right? So apply to each nostril. Route will be topical. Start and stop date will be there for 4 days and make a cross over here. Indication will be there. So write down the indication. That's it. Okay, so as you see from the scenario, patient is hypertensive. So write down the amlodipine here and write down the start date and dose will be 10 mg, road will be oral. Additional information if you can write your name and signature, done. Patient is because patient is having wound, patient is in pain, so write down the paracetamol. So paracetamol will be here, dose will be 1 gram, route will be per oral, frequency, maximum frequency is QDS, and maximum dose can be given 4 gram in a single day. Your name and signature, done. So this is all about MRSA wound infection. Okay, perfect. We are giving vancomycin for 10 days. Yes, we are giving vancomycin for 10 days because MRSA is super bug and this patient needs IV antibiotic course and we need to give antibiotic twice a day. You have to write down 8 and 20 as well. 8 here and 20 at the end. 8 and 20 because you have to give this antibiotic twice a day. 1 gram twice a day for next 10 days. So this is all about MRSA wound infection. Okay, so moving to the fourth station.
Dr. Umair, in the first page, do we have to mark MRSA as well?
Yes, you have to tick over here because patient is having MRSA, so you have to tick here MRSA.
Okay. And is the mupirocin also given in morning and evening VT dose 8 and 20?
Mupirocin is for three times a day. So you can just write down 8, and then you can write down 14, then you can write down 20. So mupirocin can be given 3 times a day.
All right.
8, 14, and 20. 20 or 22 you can write. Just make sure you're making 8 hours gap. Right. So the fourth scenario, we need to be a little quick. What was our fourth scenario? Okay, so fourth scenario is bipolar disorder. Okay, be perfect. So write down bipolar scenario. Okay, so patient, you are referred to in the psychiatric department. You are referred to in the psychiatric department. Patient name Paddy Jones. Is 40 years old. Where to mention loading dose of vancomycin. So there is no need to write down the loading dose. So we usually give loading dose on the first page. So you can skip the loading dose. We are just giving the maintenance dose. Double check with the your BNF. So in BNF, it's written only the loading dose 1.5 gram, and there's no maintenance dose. So you have to write down the maintenance dose. It's been taught by Dr. Sampson, according to his research. So you are FY2 in the psychiatric department. Patient Perry Jones is 40 years old. He has history of fall at home. Patient's past medical history, patient having bipolar disorder. Currently, patient is in pain. Your consultant has prescribed him lithium carbonate, 800 mg.
Please repeat the scenario.
So you are FY2 in the psychiatric department, 40 years old patient. Patient's name is Paddy Jones. Patient has history of fall at home. Your consultant, Dr. Simit, has prescribed some medications for him. Patient is already taking some medications. Patient is already taking atorvastatin, tiotropium, seretide, salbutamol. underlying medical condition, patient having hyperlipidemia and asthma. So your consultant has prescribed ibuprofen for the patient. So your task say write down the above medications. So medications include the routine medication, lithium carbonate, and ibuprofen. Other information you have, patient is allergic to penicillin and patient had anaphylactic reaction. Okay, so this is all about the patient information. So your ward is psychiatric ward. So just write down the psychiatric ward here. The consultant name is XYZ, Dr. Samit or XYZ. So write down the consultant name here according to your task. Write down the date of admission. Write down the patient's weight. Weight is given 76 kg. Weight is given 76 kg. Height is given 173 centimeter. Write down the height is here. So there will be some patient sticker. You have to look around on your table. If there is patient sticker, write down just take those sticker and put over here. And always compare it with your patient information, right? So again, write down your GMC number on the top. GMC number on the top and your name. Patient is allergic to penicillin. Write down the penicillin in the capital letter, your name, your signature, your date. Patient had anaphylactic reaction. Write down the anaphylaxis over here, right? So this is your first page. Okay. So there's no antibiotic given, so you can skip the antibiotic portion. So patient is taking some routine medication, so you can go in the regular section over here, right? So patient is taking atorvastatin. Write down the atorvastatin here, 80 mg per oral. Write down your name and signature. There's write down the start date, and there's no need to write down the stop date, right? So these are the 14 columns. Write down the dates accordingly. For example, here, this is your exam date. So just write down from 7 to, for example, it's 20. Fill these 14 column. So other medication patients taking tiotropium, lithium carbonate, and seretide. So these are being given in the regular section. So lithium carbonate, write down the lithium carbonate. The dose is 800 mg. Route will be per oral. Start date will be 24 by 03, right? So again, in this scenario, they are testing you either you are safe doctor or not. When you open the PNF, and you will see we can't give ibuprofen along with the lithium carbonate. They are contraindicate with each other. They are contraindicate with each other, so you are going to verbalize. Since I can see my patient has been given lithium carbonate, so from my PNF, I can see we can't give ibuprofen to the patient. I'm going to inform my senior, my consultant, and I'm going to hold the ibuprofen. Since my patient is in pain, I'm going to prescribe paracetamol for my patient. So you have to verbalize these things, right? So again, write down the seretide, 2 puff inhaler, date will be there, right? So these 4 medication, atorvastatin, tiotropium, lithium carbonate, seretide. The dose of tiotropium is 2 puff. The route is inhaler. Again, the start date and write down your name and signature, right? Tiotropium. Seritide at the end. Write down the seritide. The dose is 2 puff. The route will be inhaler. So these things will be given in your task. Just copy paste over here. The only trick in this station is either you are writing ibuprofen or not. If you're writing the ibuprofen, you are going to fail the station. So you have to verbalize. I can see from my notes, I can see from the BNF, we can't give ibuprofen along with the lithium carbonate because my patient having bipolar disorder, he's taking lithium carbonate. So I'm going to hold ibuprofen. Since my patient is in pain, I'm going to prescribe paracetamol. So write down the paracetamol here. As you know, we give 1 gram per oral, frequency will be QDS. Maximum dose is 24 gram. Again, your name and signature. Done. Other medication we are giving is required salbutamol inhaler, 1 to 2 puff, and the route will be inhaler. Frequency is QDS. You can repeat 4 times a day. Maximum dose is QDS. Again, your name and signature. Done. So this is the trick. If you are writing ibuprofen along with the lithium carbonate, you are going to fail the station. If you are holding this medication, and if you are prescribing paracetamol, so you are a safe doctor and you will definitely going to pass this station. So this is all about bipolar station. Okay, guys, moving to the fifth scenario, diabetic foot. Okay, please be a little quick for the information after asthma and hyperlipidemia. The other information is patient is allergic to penicillin. Patient is taking other routine medication, tiotropium, seritide, salbutamol, atorvastatin. So these are the other information. Patient had history of fall at home. Okay, so please write down other scenario. You are FI2 in the endocrinology. Patient's name is Jack Smith. He's 70 years old. Other information you have about the patient, he has been diagnosed with diabetic foot infection. Concerned has prescribed the following medication. Patient is being concerned and has prescribed following medication, which includes cotrimoxazole, number 1, number 2, gentamicin, number 3, metronidazole. Number 1 is cotrimoxazole, number 2 is gentamicin, number 3 is paracetamol, number 3 is metronidazole, number 4 is paracetamol. Your task is what you must do, prescribe the medication to the patient. A special note, there is no patient inside the station. Do not forget to write your GMC number on the prescription. Okay, so okay, the whole information about this scenario. Write the patient details correctly. If there is patient label sticker, apply this over this section. Right? We have to hold the cotrimoxazole. It has adverse reaction with the gentamicin, so we can't give both antibiotics at the same time. So again, they are testing you either you are safe doctor or not. So cotrimoxazole is going to be held. So you have to verbalize in front of the examiner, I'm going to hold this medication. When you check the BNF, these both medication having some adverse reaction with each other. So it has adverse reaction with the gentamicin, prescribed clarithromycin instead of chlorpromazole for 7 days, right? So again, you have to prescribe clarithromycin instead of chlorpromazole for 7 days. Route will be BD, dose will be 500 mg per oral, and you have to learn how to write the antibiotic for 7 days, right? So other antibiotic is gentamicin, write down for 7 days. So the patient's weight is 90 kg. So when you open the BNF, so BNF will say the dose of gentamicin is 5 mg per kg. And write down gentamicin for 7 days. Okay, so this section is again going to be explained next 10 days, 10 minutes.
So we have to write 450 mg per kg for gentamicin. It means
5 mg per kg.
5
So
mg per
yeah, so we have to prescribe 450 mg OD.
OD. Okay.
Yeah.
Sir, can you please repeat about what to hold?
Okay, so your task say write down the chlorpromazole. When you open the BNF, you will see there's adverse reaction of chlorpromazole with the gentamicin. So we are going to hold this medication. So we need to hold chlorpromazole and we have to prescribe clarithromycin, right? We have to prescribe clarithromycin for 7 days and dose will be 500 mg BD. We have to prescribe gentamicin for 7 days. The dose will be 5 mg per kg. Since our patient's weight is 90 kg, so the dose will be 450 mg per OD. Single dose per day, and the route will be IV in gentamicin. Route will be IV in gentamicin, right? And there's other medication, metronidazole. As you know, flagyl. We give flagyl 400 mg dose for oral for 7 days, 3 times a day, TDS, right? So these all medications should be in the first antibiotic section, and every medication is for 7 days. Why? Because the patient having diabetic foot infection, right? Patient is in pain, so write down the paracetamol as well. So in this station, the only trick is either you are writing chlorpromazole along with the gentamicin or not. So if you are writing chlorotrimazole along with the gentamicin, you are going to fail the station, right? So you have to be safe, doctor. So write down clarithromycin instead of writing chlorotrimazole. Okay. Okay, so your word is endocrinology. Write down the endocrinology here. The consultant name is Dr. XYZ. Write down the consultant name. Date of admission will be here. Weight of patient is 90 kg. Height of patient is 173 centimeter, right? There will be patient label sticker. Put the sticker and apply here, right? So patient is again sensitive to penicillin. Write down the penicillin, your name, your signature, your date, and patient had anaphylactic reaction. Write down over here, anaphylactic reaction, right? So moving to the antibiotic section. Okay, so as you know, we are not going to prescribe chlorotrimazole. You are going to verbalize this inside this station. So write down the clarithromycin. So when you open the BNF, and the next medication can be given, because we can't give any growth from penicillin because patient is allergic to penicillin. So if patient is allergic to penicillin, second drug we usually choose is clarithromycin, right? So write down the clarithromycin here. The dose will be 500. The route will be oral. The start date will be of your exam date. The stop date will be next 7 days, right? So count no next 7 days. Write down here. Your name and signature. Indication is diabetic foot infection, right? So fill these columns 1, 2, 3, 4, 5, right? Then come on this side 1, 2, 3, 4, 5. So since there's no change in route and medication, so just fill this column as normally. And when you reach in the second column over here, the 7 days are finished. The next three columns of the lower second section make big N over here to stop this medication. Big N over here in next last three sections, right? So the clarithromycin will be in both columns, here and here. The dose will be same, 500 mg. Route will be same. Oral start date and stop date will be same. Indication will be same. Your name and signature will be same, right? So these 5 upper section and these 2 lower section, and the next 3 sections of the lower section, lower column, make begin, right? This is how you are going to write the clarithromycin. Then write down the gentamicin. According to the weight of patient, the dose will be 450. The dose will be IV. The start date and stop date will be 7 days. Gentamicin in the capital letter. Fill this fifth upper section and then lower 2 section. Make begin in the last 3 sections, right? So similarly like clarithromycin. Write down gentamicin 450, 450. Route will be IV. Start date and stop date. Indication everything. Third medication is metronidazole. So write down metronidazole here. The dose will be 400 mg, route will be per oral, start date and stop date will be there, and your signature indication, everything will be there, and write down for 7 days because here there are only 5 sections. So fill these sections, and there's no other section for antibiotic. So you can skip, but you can write down for 7 days. Stop date will be 7 days. In additional information, you can write this medication is being given for the 7 days. So still you are in the safe place, right? So this is how all about you have to fill all antibiotic sections. There are 4 columns in each antibiotic section, and every drug is being prescribed for 7 days, and every drug is going to be occupied 2 sections, right? Okay, so patient is in pain because diabetic foot infection, wound infection is always painful. So write down the paracetamol here in the is required section, right? So write down paracetamol here. And since patient is having diabetes, he might be having some regular medication. So if there are some regular medication written, you can write the regular medication here. Since this station is too big, so might be that's the reason they are not giving you extra medications, right? And always when you run out of time, so you can verbalize some things, you can verbalize some medications just to give impression to the examiner that you know the station, right? So this is all about diabetic foot infection. Okay, so five station has been done. The last two station is COPD and atrial fibrillation, right? Okay, COPD is the old one. I think everyone knows about this station, COPD. Okay, so